Say you decided you wanted to go traveling and you thought, hey, I should totally go mountain climbing. So you're up there and suddenly you don't feel too good. You feel dizzy, nauseous, and you have a killer headache. Well, you might have altitude sickness. So what is altitude sickness? Well, firstly, it will be useful to understand how the atmosphere changes at higher altitudes. The higher you go away from the Earth's surface, the less dense the air is. This means there's a lower concentration of oxygen for your body to use. Altitude sickness is effectively your body struggling to function with less oxygen than normal. Your body will panic in this state and try to help you by increasing your breathing and your heart rate. So now that we've gotten that out of the way, we can focus on what altitude sickness actually is. Altitude sickness normally occurs at altitudes of 2,500 meters and above, and it has three main forms. The mildest form is known as acute mountain sickness, or AMS. The next two forms are known as high altitude pulmonary edema, HAPE, and high altitude cerebral edema, HACE. The main symptoms of acute mountain sickness are very similar to textbook symptoms of other illnesses. They are nausea, headache, and dizziness, and generally it's quite similar to having the flu. However, AMS is a massive red flag and your body telling you to do something quickly, as things can very easily progress to high altitude pulmonary edema. This is a potentially life-threatening condition where fluid builds up in the lungs. When your body is starved of oxygen, the blood vessels around your lungs constrict to increase the pressure. This, however, is what causes the fluid to fill the lungs. A lung that is full of fluid cannot absorb oxygen, creating a vicious cycle. High altitude cerebral edema is a build-up of fluid in the brain, and again, this is an emergency. The brain fits very snugly in the skull and doesn't exactly have much wiggle room, so any swelling can very easily lead to damage to the brain tissues. To prevent altitude sickness, the best thing you can do is to properly acclimatize to the height. This means going up slowly, and as a general rule of thumb, not going up more than 300 to 500 meters a day. But to avoid altitude sickness completely, maybe go traveling somewhere with less mountains and climbing.
Thank you for watching today's video. If you have any questions, please leave them in the comment section below, and don't forget to subscribe to get more videos. I hope you have a great day.